Quad muscle group. Sartorius muscle. Quad tendon. Patella. Patellar tendon. Tibial tuberosity. Lateral meniscus and joint line. Fibular head. Lateral collateral ligament. Popliteus tendon. Biceps femoris tendon. IT band. Gerdy's tubercle. Medial meniscus and joint line. Medial femoral condyle. Medial tibial plateau. Medial collateral ligament. Pes anserine tendon and bursa. Semitendinosus tendon. Gracilis muscle. Hamstring muscle group. Popliteal fossa. Heads of the gastrocnemius muscle.
Right, so we're going to do a little active range of motion. So can you bring your heel to your butt? Great. Can you bring it back down? Great. Can you push your knee into the table? Awesome. Okay. Yep. Can you bring your heel to your butt? Perfect. That should be 135 to 145. Can you bring it back down? And into the table. Perfect. Should be 0 to 10 for extension. So I'm going to do passive range of motion. This should be all bilaterally. So I'm going to do the same thing, just I'm doing it. Great. All right, so now we're going to go into, we're going to do manual muscle. So can you slide down to the end of the table? Okay. And you push against my hand. Perfect. And then we're going to do flexion. So can you roll over, please? All right, so you're going to bring your leg up against my hand. Perfect. Internally and externally. Great. So now we're going to go into the special tests. The first one is a sweep. That's checking for swelling. The next one is ballotable. I'm going to push and make sure that the kneecap is tracking correctly and not too much swelling around it. Godfrey's 90-90. Looking for a posterior sag, and that would conclude that there was damage to the PCL. Next we have posterior drawer. So I'm going to push, and that is checking for PCL damage. In anterior drawer, I'm going to push outward, and that is checking for ACL damage. Next we have Lockman's, like so, and that is checking for sprain or complete tear of the ACL. Next we have valgus, this way, checking for MCL sprain, and you can also do it at like 20 degrees flexion. Next we have varus, this way, and then you can also do it 20 degrees as well, and that is testing LCL sprain or damage. Next we have the lateral pivot shift. And grab his leg like so, and internally rotate the foot, and I'm going to push laterally, medially on his leg, on the lateral side, and that is checking for ACL or LCL damage. Next we have the sulcum drawer. I'm going to internally rotate his foot, and I'm going to pull up, and that is testing ACL and LCL. I'm going to externally rotate his foot, and the same thing, and that is ACL and MCL damage. Next we have Houston's post-lateral, so I'm going to do the same thing, internally rotate his foot, I'm going to push, that's going to test the PCL and LCL, externally rotate his foot and push posteriorly, checking for the PCL and MCL. Next we have Thessaly's test, so he's going to stand up, single leg, bent a little bit, and he's going to twist a little, do a little boogie. If that has any pain, popping, clicking, it can result in a meniscal tear. Next we have McMurray's. So I'm going to grab around the joint line, internally rotate the foot, and externally rotate the foot as I extend and flex his leg. And that is also checking for meniscal tear if you feel like any popping, clicking, clunking type things. And the last one, we have Apley's compression and distraction test. He's gonna flip over, put his leg up, and press down. He has pain. I'm going to retract the pain, or the pressure. And if he doesn't have any pain, then it is a result of a meniscal tear. Next, we have the dermatomes and myotomes. So L1 starts at the hip and goes to the groin, and that is hip flexion. L2 is a little bit lower, and that is also hip flexion. L3, a little bit lower than L2, and that's knee extension. L4 goes down into the side of the great toe, and that is ankle dorsal flexion. L5 crosses the knee, goes to the web of the first and second toe, and that is great toe extension. S1 goes down the side of the foot and over to the fifth metatarsal, and that is ankle plantar flexion. And S2 runs through the back of the leg, through the Achilles, into the bottom of the foot, and that you test for with knee flexion. Next, we have the reflexes. The knee. And then for the ankle or the Achilles, and that is